Yeah.
Okay. Well, good afternoon. My name is Brian Miller. I am the director of Northland Career Center. I'm a member of the Northland Education Business Alliance, or NEBA. NEBA is a network of education and business organizations in Clay and Platte Counties whose vision is to promote and provide business-driven educational opportunities for you, our next generation of business leaders. I will be your host during this session, but we have another NEBA member working in the background, Courtney Reyes, who's the business co-chair for NEBA. And just a few quick notes before we get to introduce our guests. This session will run for about 40 minutes with a hard stop at 8:40. Our industry experts will begin by sharing their professional history and insight. We want this to feel more like a conversation. At the bottom of your screen, you should see an option to use the Q&A feature. We encourage you to use that space to post any questions you might have at any point in the session. We may not be able to get to them all, but we'll do our best. When this session ends, you'll be asked to take a very short survey. Please give us feedback on this event so we can get better at hosting things like this in the future. Last but not least, this session will be recorded and available on NEBA's YouTube channel in the near future. Okay, so let's get started. So Karen, you want to go ahead and start with introductions?
Sure. I'm Karen Hughes. I'm the district lead nurse for the Kearney School District. I've been an RN for almost 12 years this May. And I was like a traditional college student. I did start though in the healthcare world during high school as a CNA and worked as one throughout college. My first RN position was at the Nebraska Medical Center on the solid organ transplant unit. So I was with pre and post surgery for liver, kidney, pancreas, and small bowel transplants. I also was a substitute school nurse on the side at that time, which is how I found my love for where I'm at now. I went on to be a travel nurse, mostly along the West Coast. I did everything from ICU, cardiac progressive, just a typical med-surg telemetry unit. I worked with strokes. I went on to work, in an endocrine clinic. And then I was back to school nursing for about the last 4 years.
Thanks, Karen. Okay, I'll have you introduce yourself now, Ms. Moreno.
Okay. Hi, I'm Dr. Miralda Moreno, and I am a practicing dentist here in the Kansas City area in Wyandotte County. I own my own practice. I've been in dentistry a total of almost 32 years. I started off at Wichita State, then transferred to University of Missouri, Kansas City School of Dentistry. And I decided to get a bachelor's in dental hygiene. And I went back to Wichita and I practiced for 5 years as a dental hygienist, knowing I was going to move ahead. Finished up a couple prerequisites and I went back to dental school and 5 years later, and then graduated with a doctorate of dental surgery. And I actually went to Arizona and I joined the public health system with the Indian Health Services through Commission Corps. And I did that for 4 years. And then I came back to Kansas City area and started my own practice. So still there, and we're at 18 years there. So, yeah.
Okay. Well, I'll ask this first question. We'll reverse it back here. I'll ask this first question to you, Ms. Moreno, or Dr. Moreno. What does a normal day look like for a dentist in your practice? What does that look like?
Well, we get there about 30 minutes ahead of time, 30 minutes, 40 minutes ahead of time. We review our charts and we get together and see what patients need certain things and remind each other of certain procedures or anything special that we need to know about. We start patients at 9, from 9 to 12. 12 to 1 is lunch, and then 1 to 5. And then usually it takes, dentistry is not an exact 9 to 5 job or 8 to 5. It always takes longer for procedures, sometimes shorter. Usually we're there 5:15, 5:20, and then clean up, making sure the next day is ready and all. So then usually the doctors will stay and review charts. We'll review any notes for the next day. And sometimes I'm there 2 hours after we close. So it makes for a very long day. So sometimes 10, 11-hour days. So.
Okay. What about you, Karen? Tell us a little bit about your standard day. And I'm sure through a pandemic, both of you have a different day than you would have had a couple of years ago. But tell us about your day, Karen, standard day.
So as a lead nurse in the district, I oversee 8 other nurses and throughout all of our buildings. We have just under about 4,000 students. And for a typical school nurse, you'll have your kiddos that come in for daily medications, any treatment plans that, will help their current medical conditions. And you will see students from recess for any sort of injury or PE, and then any illness going on. And then at more of the, the district level, I work closely with administration and the local and state health departments. We review our current data for any illnesses trending, making sure we can keep our policies and procedures up to date and keeping all of our students and staff healthy and safe.
Okay. What do you see, we'll start back with you, Karen. What do you see as the most essential or transferable skills needed in this profession? If I'm a high school student watching now, what would be things you would recommend in terms of skill-wise to be successful in the nursing field?
A big one with nursing is critical thinking, kind of like problem solving. You have to look at the bigger picture of all the information you have in front of you to see, how you can take care of the task at hand. And along with that goes multitasking. You'll have multiple patients and communication. And in the school setting, that's with the student, the parents, the teachers. In the hospital setting, obviously the patient, maybe family members and the doctors. And another big one with nursing is just diversity awareness. You're going to have to make sure you're knowing exactly what your patient's cultural needs are and being able to adjust your care for them.
Great. Dr. Moreno, what about you? What type of skills would you recommend high school kids focus on as they start thinking about potentially being a dentist?
Gosh, I would say the same things, especially working well with others, communication skills. Another thing important in dentistry, of course, is working with your hands. So utmost attention to detail. If you like sculpturing, if you like art, because you're almost an artist, you're creating things, you're making new smiles, but lots of precision. So if you're hands-on, it's a great career, but pretty much the same as nursing, all the details and communication, working with others.
Great. So what, in terms of being a dentist, what types of degrees or certifications would I be prepared to pursue if I'm thinking about transitioning from maybe high school to becoming a dentist? What are the paths along the way in terms of education certifications?
So it's usually a total of 8 years of education, your undergrad, and then you go into your doctorates, which is an additional 4 years. Now, some dental schools don't require you having a bachelor's or an associate's. There's a set of coursework that's called pre-dental, and you're usually doing a lot of sciences, your microbiology, your anatomy, physiology, physics, a lot of higher math, chemistry, organic chemistry. So by the time you finish those pre-dental prerequisites, it's almost a 4-year degree. So you can get minors, like a minor in chemistry or minor in biology. I decided to take the long route and go ahead and get a bachelor's and do it in dental hygiene at the dental school, because I knew I wanted to come back and I could work as a hygienist while I was in dental school. And that experience also helped me when I got back to the doctorate program. So, but yeah, you don't necessarily have to have a bachelor's, but incoming students, you get engineering students, you get teaching students, nursing students. We had a couple nurses in our dental class, and then you move on with your 4 years. And then after the 4 years, if you want to specialize, it's an additional, 2, 3, 5, 6 years, depending on which specialty, but usually about 8 years of schooling total.
Great. Karen, what about you? What is a nurse, what type of degrees and certifications do you need to be successful in your career?
With nursing, there's a lot of different educational paths that you can follow. You can be a licensed practical nurse, LPN, which is typically, I think, like a 2-year program. An RN is anywhere from 3 to 4, depending on the degree you choose. For example, the college I went to, College of St. Mary in Omaha, you could receive your Associates of Science in Nursing and take your NCLEX for your RN license and then work, your fourth year while you finished your bachelor's. And the program was set up where you can work full-time as a nurse and then complete your clinicals for your bachelor's degree. Then you can go on to receive your master's or your doctorate, be a nurse practitioner, and just up the chain, really. I mean, as far as certifications, there's so many specialties you can get into. You can, usually you need certain qualifications to be certified, or to take the exam, and then you're able to, go into that specialty.
Sure. And both of you did a really good job explaining kind of the next question, but I'll kind of, it asked about, promotional opportunities. So it sounds like, why in school? I think one thing I hear you saying is, and I think I'm going to ask you to speak about this a little bit, Dr. Moreno, in terms of you having the benefit of being a dental hygienist first. Was that extremely valuable for you to have that direct patient care and doing those skills as you were preparing to be a dentist, in terms of that process or that pathway to get there? And same for you when I get to you, Karen, and those transferable or stackable credentials. So I'll start with Dr. Moreno. For advancement, how important was it that you have those other skills?
Oh, it was very important. It helped a lot. I mean, I was, 10 steps ahead of other classmates. We had another hygienist that came back as well. And you were just more prepared. You had seen things in private practice. You knew how to communicate to the patient. That's a vital thing in healthcare. I'm sure nursing as well. You have to know how to communicate to all kinds of patients. And we always say in dentistry, you have to be a chameleon. You're multitasking, seeing multiple patients, just like nursing. And, you have to learn to change to that person's. I mean, you could be yourself, but some people don't like to talk. Some people love to talk. Some people need things, repeated. Again, cultures, it comes into a big play in our profession as well. But no, being a dental hygienist, I was just so much more advanced. I saw what I was going to be doing. And when I went back to dental school, since I went to the University of Missouri School of Dentistry, I didn't have to take some of the same classes, and I was helping in the clinic with the other students. So yeah,
as a relevant example, I know that Courtney's from works with the construction industry. So having architects that have actually built houses or had courses where they've done framing and done those skills, so they can actually, it's amazing how transferable those skills were. So I didn't think about that until you mentioned that. So it's an exciting opportunity that you had there to have that opportunity and then transition to be a dentist. And so Karen,
yeah.
what about you in terms of, the path along the way for promotion, having skills, having experiences? How's that been to support you in your transition to where you're at?
I would agree with, having that experience and exposure of something beforehand. I was a CNA before I started, and just that intro into the healthcare world, you get that exposure, like I said, and it just helps you be prepared. You become familiar with what it's like. You can also see, is this really the path that I want to be on? And that familiarity will guide you.
Great. Well, I'm going to ask a question because of the environment we've been in, because I know what we want to do is encourage high school kids, middle school kids, and maybe watch this either now or later to go, okay, it's a pandemic out there. The two of you seem like you love your jobs. So that'll be the next question. But along the way, since March of 2020, we've dealt with a pretty tough situation across the world, across the country. Specifically, healthcare has been really challenging. So we'll start with Karen, how have you navigated the challenges of the pandemic and still found, success in your job?
I think as a nurse, you just kind of go with the flow, and you deal with whatever's at hand. And so just keeping that mindset that you're going to be able to get through it, just got to work through with whatever the illness or whatever's presenting to you. You just have to keep going and work with your team and just get through it. So it was challenging, yes, but you use your resources and you get through it.
Okay. Dr. Moreno?
Yeah, that was tough, and it still is tough for us. We're right there in the patient's mouth, and a lot of people in the profession got scared, assistants, dental hygienists mainly, and they went away. They kind of fell off the face of the earth. So we were short of staff, and a lot of dental offices are still short of staff. Hygienists, it's hard to find. Just a lot of positivity, relying on your team to stay strong. And we closed for 2.5 months. That was really hard for a lot of us. But coming back, we came on strong, and it's determination, it's integrity, it's taking it day by day and knowing that it'll all be okay. You just, like Karen said, you go with the flow. And if you have a good team, you're there, and educating patients that, okay, we're using this, we're using that. We always have, even before COVID, all of our PPE, which is the goggles, the mask, our jackets and all. So we didn't really change anything. We had been doing that all along. And you just have to stay strong and focused, and just take it day by day. It is what it is. And again, educating patients that it's okay to come to the dental office, and we will take care of you.
Sure. Well, let's switch gears, and I'm going to ask you a question. What do you love about your job? What makes you love it so much? Start with Dr. Moreno.
I love that I get to work with all ages. Pediatric, kids to geriatric. I get to go out into the communities. I get to do a variety of things. My love, though, my favorite thing is pediatric dentistry, and I love to do oral surgery, which is extractions and, taking out all the teeth and putting in a full denture, making someone smile, really. Also, I have the opportunity to go out into the communities. Wyandotte County used to have something called hip hop health fairs. And so we would go out all day, and we would see between 200, 400 kids. And we would do screenings, but not only screenings, educating the kids about our profession, hopefully having them get some interest in different things that we did. I had poster boards on like what piercings can do and things like that. So, and then also we've always taken part in community services. So for example, we do something called DDS, donated dental services. So those are for patients who are less fortunate, who cannot afford dentistry or do not have insurance. And we take a case at a time, complete it from beginning to end, with some specialists also helping us out in that program. And it's an amazing thing. It's incredibly amazing and satisfying to change someone's life. But I get to do a little bit of everything, and I get to set my own schedule. So there's a lot of things I love about my profession. So.
Wow, thank you so much.
Mm-hmm.
Hey, Karen, what do you love about your current position and what you do?
I would agree with being able to work with all age groups, more so children in the school setting, but you also have to work with parents and staff. So you get it all there too. But I would say, as a nurse, you're kind of that link to keep their health journey going, no matter what field or area you're in, from clinics to hospitals to schools, to whether you're on the IT side of it or insurance companies. The nurse is there to just keep it going, and you always feel, I guess, valued wherever you're at.
Thank you. I'm going to remind our audience this time, if they have questions, to put them in the Q&A, and we'll definitely make sure that your questions get asked. We have 2 more scripted questions, and we may wrap up early, but if you have questions you want to ask either Dr. Moreno or Karen, please put them in the chat, and Courtney will share those questions with us. So I'm going to ask the next 2 questions together. So, and it kind of supports a little bit what we just talked about, but what do you find is the most challenging thing about your career, but what do you also find is the most rewarding? So maybe supporting the challenges and the reward at the same time. So we'll start with Karen.
Well, I would say challenging right now, especially for nursing, would be, safe patient ratios, not only just to protect your patient's safety, but your nursing license as well. So that's something to consider about your place of employment. And then also with it seems that there's always some new type of diagnosis coming out that we may not have the best, evidence-based practice yet on how to treat or take care of that. And it can be frustrating when you want to do all that you can for that patient, but you just don't have those resources. And so just kind of getting through the moment to help them. And then as far as rewarding, I love the relationships that I get to make with the students and family members in the community. And also just being a leader, you're that bridge in healthcare, and you can allow every student to learn to the best of their ability, no matter what their health condition may be. And you get to help provide that setting for them.
Okay. Dr. Moreno, most challenging, most rewarding?
Most challenging in the career, I would have to say management, the business management and the staff management. You're really not taught that in dental school. So you're taught, a variety of surgeries and procedures, and it's as intense, when you're working with kids under nitrous and things like that. But they never teach you anything about the actual, business sense, how to run the business, the staff management. They're like, you'll learn that later. You'll learn that later. And so all of us, as we come out of dental school, it's like, wow, I wish they would incorporate some business courses in there. And it's a constant learning process. The staffing is constantly changing. Again, we're short of dental staff altogether, especially after COVID. And it's challenging, and the business part as well. And you usually depend on your tax accountants and business consultants and things like that. But I would say that's the most challenging part. And you don't have time for that because you're with patients all day long. You're very tired sometimes at the end of the day, and then you're working on charts and all. And where do you find the time to, learn all that? So you do delegate a lot of things. Doctors have to delegate, whether you're a medical doctor, dentist. We delegate a lot of those things, and you hope you find the right person that can take care of that. Sometimes you do, sometimes you don't. But the most rewarding, like I mentioned, is just helping those, changing someone's health, and helping others. There's all kinds of opportunities and programs to go out and do things. I know the Kansas Dental Association that I belong to, we do a dental day, and it changes from city to city in Kansas. And you go and volunteer and do dentistry all day long for 2 days. Going out into the community, seeing the second generation come into your office, that tells you how old I am and how long I've been in dentistry, 32 years. So that's kind of neat to see the kids grow up, and then they bring their kids and all. But just working with people and in my practice, we're like a family. So with our patients, so that's very rewarding.
Thank you. Courtney, do you have any questions of your own, or I don't see any in the chat?
Yeah, absolutely. Do you guys, first of all, thank you ladies for what you do. You guys are champions. So, but do you guys have any advice for the young kiddos that are trying to, be who you are or step into your shoes? What you'd recommend for them to take, whether it's courses or things that they should be considerate of or work on to kind of be successful?
I would recommend, if you're good at science, if you're good at math, if you're good at art, consider dentistry. Also reach out to your dentist. I know some high schools and middle schools, they have programs for careers. And I have students, come into my office and they observe and they see what it is to be a dentist, and we welcome that. I've had several of my patients, and I start really young too. I'm like, hey, you want to be a dentist? Because when I get old and gray, I need someone to come and take over. And I'll let them hold a mirror, and I'll, just get them interested. And I have some that have gone through. So, but yeah, reach out to your dentist. Your career programs in high school, and actually go into the field and see what it's like to go into that specific career, or go to the dental school. They also, have students come in there all the time. So yeah, and my office is always welcome for those who are interested.
Great.
What about you, Karen?
I would definitely agree with that. You can be a volunteer at a hospital. You can, request a job shadow somebody. We take, student nurses as well in the school setting. So you can just get that exposure and see what you're interested in.
Absolutely. Dr. Moreno, you talked a little bit about that business side of things, and I would love to hear a little bit from you about just, I think that's something that kind of always gets overlooked. They're like, go and grab your skill set and then come and run a business. Do you have any advice in that area or things that you've learned that you would want to share with us today in regards to business management?
Just involve yourself in seminars, look to your friends and colleagues and, who are accountants or have MBAs. Actually, we had a few people come into dental school that had their masters of business, and that helped them a lot. But really reaching out and just asking questions. There's plenty of seminars. Your accountants are also a good resource, but reaching out to others and just learning. My husband actually is doing the business part. He is a pharmacist. He left pharmacy to run my practice. So he's been doing that for, I believe, 7 years now, 7 or 8 years. So he's I depend on him a lot. He's our IT guy. He's our pharmacist for questions when it comes to new medications and all that, which we're on top of too. But there's one that always gets me like, I haven't heard of this one before. And he's like, oh, that's, whatever. So he does a lot of it. And he's had to learn as well. And when he first took over, he went to our oral surgeons that we refer to and hung out with their office managers. So again, leaning on colleagues, leaning on friends to learn, because there's different ways of doing things. And as you go along the way, you will stumble, make mistakes, but it's a learning process. And you don't want to make mistakes or anything, but with anything, it helps you to move on and become a better, business manager or business in itself. But yeah, always looking to see if there's any courses and what you can do to improve. So yeah.
I love that you talked about community so much within that and kind of working with other people and learning from different businesses. I think that is essential and really, really helpful. So awesome. Brian?
I don't have any other questions I don't see in the chat. One thing I would say for anyone that's watching or listening out there is that based on the feedback and direction that our two guests gave us, we have 3 off-campus programs. I support one of them myself, but we have Excelsior Springs has a career center that serves a lot of our Northland high schools, and they have health services, and then Northland CAPS has multiple teachers that serve a strand called medicine and healthcare, and then Northland Career Center, we're actually fortunate enough to add a teacher here shortly for a 3rd teacher. We have what's called health sciences. So ours is more focused on nursing. So kids in the Northland have classes at their high school through biomedical sciences and other programs. We have programs off campus. There's ways to create pathways in high school to get exposure. I actually have 2 young ladies that are shadowing a dentist in Smithville right now. So, so I think there's opportunities for kids. If you're interested in healthcare out there, these are 2 great examples of successful professionals in the healthcare industry, and I would highly recommend our middle school, high school kids get engaged in healthcare. Don't let the pandemic scare you. There's needs out there, and I've been to the dentist. Not that I love going to the dentist, but I've been to the dentist every 6 months since it started, and it's been fine. So that's all I got. I'm just really appreciative for both of you to share your stories this morning. So
you're welcome. You're welcome. My pleasure.
Thank you, ladies.
Any last words for either one of you as we wrap up, or anything?
No.
Okay. Well, it's been a pleasure. Thank you for being with us this morning. So
thank you. Thank you for inviting us.
Absolutely. All right. Well, I know that there will be a survey as we close this, right, Brian? Is there anything else we need to share before we go?
Not that I'm aware of. I'm really